My name is Mazda Turel and I am a neurosurgeon at the Wokhart Group of Hospitals, Mumbai Central. A neurosurgeon is somebody who operates and treats conditions of the brain, the spine and the peripheral nerves. June 8th being World Tumor Day, we are going to talk a little bit about brain tumors today and help spread some amount of awareness for people to understand the basics of brain tumors, how they can be diagnosed, what are the treatment options available, and how one can still have a good quality of life despite being treated for a brain tumor. Brain tumors fall into two broad categories. One is benign, means not cancerous, and the other is cancerous or malignant brain tumors. Roughly half or 50% of brain tumors are benign and half of them are malignant. The way to diagnose them, oftentimes all patients complain of is just a simple dull aching headache. So if you're having a headache for about 2 weeks that's not going away, or if you have headaches associated with vomiting, double vision, then you should consult a physician next to you and get an MRI of the brain done. It's imperative that any headache that doesn't go away, or any sudden onset headache or any new onset headache that is very severe, should be imaged with an MRI or a CT scan to rule out a brain tumor. Sometimes patients complain of seizures or epilepsy or fits, and those occur because of irritation of the brain surface because of a brain tumor. Oftentimes patients will have symptoms related to the location of the brain tumor, such as they may have some double vision, they may also have reduced vision, they may have change in taste, difficulty in hearing, depending on what cranial nerve is involved. Also, they may have weakness of the hands or legs, subtle imbalance while walking, etc. So if you have any amount of neurological dysfunction that you are able to identify, then you should not ignore it. You should astutely identify it and then go to a physician who is able to treat it based primarily on some form of imaging. Brain tumors can be treated in various ways. Some brain tumors are incidentally identified, and these tumors can be even observed without offering upfront surgery, and most often these tumors are benign tumors. Some tumors can be followed up with serial observation to see if there is any growth in the size of those tumors. Again, that kind of a protocol is reserved for benign tumors. And then there are various treatment options available for tumors, surgery being the mainstay of option. Surgery involves opening up the head with a craniotomy, or sometimes we can remove these tumors from the nose as well. Surgery is relatively safe, effective, and more or less has very, very good outcomes. Oftentimes, surgery may need to be followed up with radiation or chemotherapy as an adjuvant therapy to brain tumors. You might have heard of something called as gamma knife therapy. That is also reserved for certain tumors, both benign and malignant, that are primarily small in size, roughly less than 2.5 to 3 centimeters. We also have what is called as laser interstitial therapy, some kind of therapy that allows us to ablate deep-seated tumors in the brain by using a thermal coagulation current. So these various options form primarily the mainstay of treatment for brain tumors, both benign and malignant. There have been many recent advances made in brain tumor treatment and research. The advances that are made in treatment are that the ease of surgical excision has improved because the tools for excision have improved. We are now able to use very, very fine micro instruments. We have the ability of an intraoperative microscope. We have intraoperative imaging that allows us to identify if residual tumor is left behind. We have intraoperative navigation system that takes us straight to the tumor, and we also have robotics. All these use of high-end technology is helping us make tumor removal more optimal, more safe, and to the benefit of the patient. In brain tumor research, molecular biology has come up with now being able to identify each tumor each patient's tumor as their own individual tumor, and we can target specific therapy directed towards the tumor. We have vaccines for brain tumors, we have immunotherapy for brain tumors, we have tumor ablation fields for brain tumors. So we have various technologies and advancements in the diagnosis for brain tumors. Raising awareness for brain tumors is extremely important because, as with any tumor, early detection and diagnosis is the key. We need to make people aware of the symptoms of brain tumors, and the most important thing to tell people is to not to ignore headaches. A lot of the times people ignore a headache which may be coming from a brain tumor, and people allow that headache to fester on inside their heads until the tumor becomes large, or a benign tumor becomes malignant, or a malignant tumor becomes to an extent where it may not be entirely treatable. So raise awareness of symptoms such as headaches, seizures, any kind of neurological dysfunction should not be neglected and should be addressed immediately and imaged with either a CT scan or an MRI of the brain. Hence, once we have this awareness, more people will take responsibility of their health in their own hands, diagnose brain tumors early, and help us fight the battle against brain tumors, primarily brain cancers, which still don't have a very good outcome despite all forms of modalities of treatment. Unfortunately, there are no known preventive measures for brain tumors. Brain tumors primarily happen because of an abnormal mutation in a particular gene, and that can have, let's say, environmental effects, or it could be genetic in certain cases. There is very little that we can do primarily to prevent brain tumors. Some people say that excessive use of the cell phone can cause brain tumors, electromagnetic radiation can cause brain tumors, but we don't have a foolproof knowledge of that as yet. So, and we are surrounded by technology, so it's impractical to advise anybody to stay without a phone. It's impractical to advise anybody to not use a gadget in today's day and age where life is completely dependent on them. So I would still say that early detection and treatment happens to be the key in diagnosing and treating brain tumors optimally to end up with a good quality of life. So dear friends, having a brain tumor is not the end of the world if we diagnose it early and treat it appropriately, and if biology is on our side, we can have a good quality of life. Yes, unfortunately, sometimes if the tumor is malignant, there may not be a whole lot we can do, but for early grade cancers and for benign tumors, neurosurgery along with adjuvant forms of treatment can help improve quality of life dramatically and can give a lot of people a good overall existence and can live a very happy and long life without any problems. So it's important to address any neurological symptom you have without delaying it. Thank you very much.